Hi everyone, this is Dr. Wan. Once more, welcome to my channel. And today I am to address two important topics here. The first one is with regards to the question that a patient asked on the diabetes platform, wondering if she can stop her diabetic medication now that she's doing great. And the answer is not a straightforward yes. Reason being that handling diabetes is not something, it's not like a walk through the park. You need to be careful here. Age is matter, lifestyle of the patient also matters. So if this patient is over 65, I would tell you be careful here. If this patient is say 25, I would say somehow yes, but again we need to also take care of what we call BMI. So if the BMI is over 26, then I would tell you no, patient can't go off diabetic medication. A lot of work still has to be done. So that's the summary. So now I always push forward what we call holistic approach. What does that mean when it comes to managing of diabetes? Essentially, it consists of everything around you, including your family, your loved ones, friends, and everyone. That's what I'm saying. So we don't only look at the pharma part of it, but look at also other things around your environment, say your lifestyle medicine. That's what I'm trying to say here. So the very first thing here, it is what you eat. Remember, I've been saying it that you are what you eat. So it's a very important factor here. And the first thing which I will hamper on, it is green leafy food. Remember my famous chart on glycemic load and glycemic index. So you have three classes of food with various glycemic indices and various glycemic load. So you need to focus on those one with low glycemic load and as well as low glycemic index or glycemic indices. And having said that, green leafy food are number one. And also, those green leafy food needs to be crunchy, needs to be raw if you can. And when I say raw here, I mean it. And I'll tell you why I'm saying that the food should be raw. So, harvest all what you want to harvest, say like bitter leaf, bitter cola, and everything that tastes bitter is what we have to hamper on. So you do not have to cook those things because they have what we call biocatalysts. So they undergo biocatalyzation. So you temper with the sulfur bridges of those substances present in there. We call them biocatalysts. So I don't want you to damage those biochemical structures. They should remain there. And the good one, it is the nitric oxide. Nitric oxide is up there. It helps in cleaning the tubes, the arteries of your heart, the capillaries and other stuff down there. So that's why I say your food should be raw and crunchy. So that's my message to you. Whatever thing you want to eat, if you can make it raw and crunchy, and then you are doing the right thing. Stay away from anything white. I'm not by this saying that I'm against the white people. No. What I'm saying is white here, I'm referring to white rice, white flour. Anything white, stay away. Then when it comes to things that are non-organic, for instance, there are two types of proteins. We have the vegetable proteins and the animal protein. Keep the animal protein away and focus more on vegetable protein. And that vegetable protein, you have to learn how to make smoothies. Smoothies are loaded with nitric oxide. The nitric oxide, it is the driving force. So they clean all the tubes, they unclog them to be more precise. And that's what you have to get used to as a patient suffering from diabetes. If you do that, believe me, your life will be easygoing. You won't have any hassle down the road. Blood sugar value will definitely plummet as we've always wanted it to be. There won't be any issue of blood sugar value spiking. So that's the essential thing here. So again, remember, your food should be fresh. And if it's fresh, it means that you have to eat it raw. You don't need to cook it. Just prepare smoothie, get it ready, and make sure you consume this smoothie at least 3 times a day. Say morning, midday, and evening. That should be what we are supposed to do. And then now we can take out the blood sugar value and you will see that things will be normal. There's no witchcraft here. There's nothing like formula here. All is science. And remember, I practice evidence-based medicine. It is not a doctor, what you people say in the quarter. No, we don't do such thing here. When it comes to diabetes, forget about anything and a doctor or hearsay. No, we go evidence-based, and the good example is what I've just given. Try to pay more attention on what you eat, what you grow them yourself. So forget about all those processed food, all the food. Don't get involved. Keep it aside. Grow yours. Stay away from pesticides, because I know there are some apples. People like apples here. Again, when you go to the market to get apple, for those who don't have enough space in their house or their compound to plant them, I would say do not buy shiny apples. Shiny apples are not good. They are detrimental in the sense that they have what we call phthalate. They are phthalated apples. So they make them shiny to keep them on the shelf for a longer period. So such things, I would tell you, stay away. Because if you have that habit of consuming shiny apple, then you are indirectly consuming what we call phthalate. And those phthalates have a lot to do with your endocrine system. So we call them endocrine disruptors. So I don't want you to get involved into such dealings. Another key thing, it is pesticides. Like I said before, do not use pesticide also. Stay away from them. And if you choose to go with the salads, as I was saying, your food should be raw and crunchy. I know somebody will ask me, what about those that you grow them with pesticides? Yes, that one for sure. There are options. There are things that you can do to take away those pesticides. I remember in one of my videos, I did talk about bicarbonate. Bicarbonate are very important. That is, or what we call amochina. It's a typical Italian product that you buy from the shops. And when you bring home your vegetable, which is raw, and you want to eat it, say to make your salad, you simply just put that amochina there, which is something similar to bicarbonate. And it helps to take away the pesticides. So that's another good thing, because I don't want my followers to be kind of concerned by saying that, oh, what do we do with pesticides? I've just answered that question right away. So that's the important thing that I want you people to know. So make it a habit. Eat as much as you can when it comes to green leafy vegetable, and let them be raw also. Stay away from food that have high glycemic load and high glycemic indices. Stay away from them, because they will spike your blood sugar value the next morning. And another key thing here is animal food. animal, exactly, or call it meat, I would tell you, do not get involved. Stay away from them. And believe me, by the time you realize, your blood sugar must have normalized. So that's the message for you. And what again do I want to add? Activity, yes. Physical activity also is another one. Remember, we have 3 types of muscles on our legs and also your hands. Yes, so I will advise you to make habit of clapping every day, even if you don't go to church. Learn to clap your hands. The more you clap your hands, the lower the chance of your blood sugar value spiking. The more you try to walk in your own bedroom by tiptoeing, the lower the chances of you having high blood sugar value. So those exercises are very important. You can get some dumbbells. Dumbbells are like some small balls attached to each other that you lift them up and down. We call them dumbbells. So get some dumbbells for yourself, or get some small stones in the quarter, put them in bags, and try to lift them up. That way helps also to reinforce the muscles, because we need to do what we call hypertrophy. When the muscles are hypertrophied, that's good news in the sense that there's that high request of ATP. So energy is needed to build them up. So the more you build those muscles up, bodybuilding, it helps also to reduce down your blood sugar value. So make it a habit. Even if you are on a wheelchair, you're a lay person, that doesn't stop you from being active. You can use your hands, you can get the dumbbells and move them up and down, and that should be fine. And so that's it. Please do not forget to like, share my link with others, write your comment, and I will answer you as soon as I can. Thank you and have a wonderful day. Dr. Wan. Ciao.